Hello, everyone. Today I am doing my case study summary presentation. And for my case study, I did acute myeloid leukemia with NPM1 mutation. So for the patient's history, I had a 72-year-old male that was admitted to the emergency room because he was told by the hospital cardiovascular doctors to visit the Stonecrest in Smyrna, Tennessee. He was currently experiencing dyspnea issues, which is just issues with your shortness of breath in your lungs. And so the doctor ordered a complete blood count with differential, a CT scan, a regular differential, and then also a complete blood scan with a complete blood count with manual differential. There was also some chemistry labs that were ordered, and that was just a regular CMP. So with the CBCD results, it showed that there was an elevated level of red blood cells and an elevated level of MCV, which is the mean corpuscular volume, which is just the volume of the blood or the cells. And so there was also a low level of red blood cells, hematocrit, hemoglobin, and also platelets. So with the diff results, it showed that there was a high level of blasts, NRBCs, monos, meta, and myelocytes. So with all of those results, it was determined by the doctor that they would order a flow cytometry and also a FISH. And also with the chemistry results, the patient had like a slightly elevated potassium, a CO2, high glucose, BUN, and also creatinine. So some of the questions that I considered after reading about the patient's information, history, medical history, and stuff like that was what would cause the abnormally low levels of RBC and hemoglobin? And why was there an elevated level of blast? Also, what would be the reason behind ordering the flow cytometry for this patient? And what is the clinically significance of CD markers indicated in the flow report? And what lab results ultimately helped determine this type of cancer? So with the diagnosis, the flow cytometry report was ultimately what really helped diagnose this patient. Because the report had detected a 31.8% of blast population, and a 17.4 CD34 positive blast, and having an abnormal myeloid immunophenotype. So in the flow report, it says that the presence of more than 20% of blasts in the peripheral blood is diagnostic for acute myeloid leukemia. And that was currently determined by the criteria of WHO, which is the World Health Organization. And so with AML, it's basically a cancer, an acute cancer that affects white blood cells, primarily those of like granulocytes and monocyte types. It starts in the bone marrow and then it quickly moves into the blood. And it's important that the doctor determine more than whether the AML is present in the body, because it can also help understand with the general help of the patient how the patient will handle and whether or not they can undergo like a rigorous treatment. because this cancer is a very progressive, like a rapidly progressive cancer, and it affects the white blood cells called myelocells, and it initially just interferes with the production of normal white blood cells, red blood cells, and platelets. So that's most likely the reason why the patient had such an elevated white blood cell with the blast and such low levels of hemoglobin and red blood cells and also platelets. And with like with the question about the lab results that helped indicate the type of cancer, really it was the CBCD, and with the CBCD, it is really highly connected to whether you do a flow cytometry, which will better inspect the cells in the body, which can help diagnose most cancers when they're in the body of any person. So I believe the flow cytometry was really the ultimate result that helped indicate it was acute myeloid leukemia. So for the treatments, the treatment was basically chemotherapy. And with chemo, the patient basically had to go to an oncologist, which is the type of doctor you go to that helps you basically helps plan and oversee your chemotherapy treatments. Because with chemotherapy drugs, they're basically chemicals that help kill the cancer in the body. And chemotherapy interferes with the cell's genetic materials, which disrupts the process by which the cancer cells grow and multiply. And cancer cells are easier for chemotherapy drugs to target because they do multiply more quickly than most other cells in the body. But also for like chemotherapy, there's definitely cons about chemo, which is the fact that it also damages healthy cells, which leads to like side effects like hair loss, which is one of the main side effects that most people do end up getting because of chemotherapy. I've seen a lot of patients with cancer, whether it be like in person or just through like articles and just in hospital settings where they do undergo chemo. That's mostly the main side effect that happens when you're undergoing that treatment. But mostly your treatment when it comes to chemo, it just depends on many factors. For instance, like the type of cancer that you have and what stage of cancer, what stage the cancer is in. A lot of cancers do have stages where they will progress more rapidly and intense, whereas like myeloid cancer or myeloid leukemia doesn't really have stages. It just progresses too fast for stages of cancers. But with that, you also need to consider like the patient's age and like how healthy they are currently, even with the cancer, because that can all affect how the chemotherapy goes and also how strong your chemo drugs are. And so like with chemotherapy, it's given in cycles, and the patient will get like the drug for a certain number of days and then stop taking it for a certain number of days. This is used because time off the medication gives the body time to recover, and it also allows the healthy cells a chance to regrow. The medication can also be given in different ways, and there are different types of chemotherapy, but the most common one is usually the IV chemo, which is given through a needle or a tube, a thin tube directly into the vein. Some other lesser known chemotherapies are like oral chemotherapy, which is just pills, capsules, or liquid being ingested by mouth. And there's also injection chemotherapy, which is just given as a shot under the skin of the arm, leg, or abdomen. So, in conclusion, with the case study, the patient was diagnosed with acute myeloid leukemia with NPM1 mutation, and the AML causes just the cells in the patients to develop prematurely in the bone marrow, and it just sends them out like that into the bloodstream. And because the leukemia and the NPM1 mutation, the cells were not able to function properly, which started to affect the body. And that's probably the reason why the patient started to have difficulty breathing and his lungs not fully working the way that they needed to work. And also finding blasts and the NRBCs and the monos and the meta and just those types of white blood cells in his body were a very helpful indication as to the fact that there is something going on with his cells, and that should be looked into because it might be something more serious. And that also helps the doctor figure out what he needed to order, which would help initially with the diagnosis. And the flow cytometry was one of the more important orders that he did, which in the end gave the ultimate decision of what the diagnosis was. And so with that, the doctor was able to indeed confirm that myeloid or acute myeloid leukemia was what the patient had. And with that, they can further their investigation and into treatments and solutions to help stop the cancer in this patient in order for him to get healthier and to try to reverse the effects of the cancer in his body and be able to stop it from affecting the rest of his organs, especially the lungs and liver and any other important, really main important organs that he needs to survive. But that is all for my conclusion of the case study essay that I did on acute myeloid leukemia with NPM1 mutation. Thank you for your time. I hope you guys enjoyed.